Our healthcare system is broken. So let's do something about it. We've launched The Real Value Exchange, a podcast to share the stories of providers, entrepreneurs, and the change agents pushing healthcare forward.
So on my way to go interview Dr. Lee. He's the head and leading this MII, which is the Medical Innovation Incubator here in Los Angeles County. So I'm excited to have this conversation because I think he has some different strategies that he's deploying to really help change up how we view healthcare and how we operate, especially with diabetic care, which means a lot to me. So with that said, guys, I'll keep you posted on how this shakes out. Now I'm just trying to find the building where it's located in. Dr. Lee, how you doing? I'm Joe Lemon.
Yeah.
Great to meet you, man.
I got started.
No,
Let me
you're
give
good.
you something.
No, it's me. You're value, and that's where I see healthcare kind of going. And so I was like, I want to start a whole healthcare agency around it. I want to help try to highlight the people that are up to those good things. Yeah, and market those guys. Yeah, so that's my skinny.
It's a very, it's a really good space to kind of get in right now.
Think so?
Yeah, I think it's still people.
Oh, 100%.
So how would we we gotta get everyone at least to a level playing field. Like don't talk about jargon. Just tell me straight up. A patient comes up to your clinic, right?
What's your solution?
What's your solution?
Yeah.
Right. That's and don't just tell me. I don't care about. Just tell me what can the patient expect, and how are we gonna make this better? That's all.
To me, those are the conversations that are missing. I'm like, I had a podcast I was doing for about almost 6 years. And guys, I gotta cut it off right there. So because we got into it, man, it was one of the best meetings I've had, hands down, since I've been in LA. And I gotta tell you, Dr. Andy Lee, he's up to some serious things. So what his incubator is about is bringing in patients as well as physicians to try to solve issues around how fragmented the whole healthcare system is. Now, this is really important because I haven't seen anybody else do this throughout the U.S., but they're asking the patients what they need. Now, this sounds pretty simple. It sounds like elementary business practices. Like if you were launching a business, you would want to talk to your customers. You want to listen to them first. You want to understand what their true needs are, what their real desires are, especially in sales. You understand that sometimes, most of the time it really comes down to a price play, like who has the cheapest price, but maybe somebody wants to save time because they want to spend more time with their family. Whatever that problem that you're trying to solve is, digging into it and understanding what the real roots of their pain really are, and then coming up with a simple solution is something I've never heard of people doing in healthcare, and that's what he's setting out to actually achieve with his MII group out of LA. So, man, he's kind of opened it up and gave me the green light to come and kind of document some of these processes. So I can't tell you how excited I am to just be able to be like a fly on the wall, side by side with the patients and helping. And this goes way beyond just like patient advocacy, right? And you're just kind of laying out a plan, and then trying to quote unquote get behind the patient and be their advocate. But instead, they're side by side with the people that are building out the system. And Dr. Lee has to educate and also groom the patients to understand how the system works. And so, man, this speaks to how complex the actual system is. But it takes somebody who's willing to kind of fight to keep it simple, and also has the proper support to even go about executing on this. So he has some higher ups that are really allowing him to work the whole LA County, which has, I want to say, roughly about 160 plus clinics. And so they can run these pods or these different stations where they're going to try to hack away at some of the most devastating diseases that people are actually dealing with. And not so much saying that they're going to get rid of the actual disease, because that's not what their main focus is. But the focus is to treat and listen to the patient to really solve what their needs are. And sometimes this could be something simple as how they want to go about picking up their actual medication, Did he want it sent to their house, or did he want it sent to their jobs? I mean, you might not think, oh, that's not a big deal, but if you're relying on your medication, that could be a deal breaker for you, right? And so, a lot of times what happens is you have these top-down initiatives that just come out, and everybody's supposed to jump. So it's really, really refreshing to hear someone that wants to take it from a different stance and hear from the patient. So with that, I think this is a perfect way to wrap up my season 1. This is 50 episodes in of the Real Value Exchange. I want to thank you guys so much for coming along for this experience. Tune back in to season 2. Man, I'm going to be spending more and more time around this whole initiative, really, and what they're doing at this incubator, because I think it's like one of those once in a lifetime opportunities. And man, I would love to share with you everything that I'm kind of learning, because hopefully somebody else can take it and run with it, because that's what it's about. So with that said, guys, I want to thank you so much for tuning into the Real Value Exchange as always, and please follow me, connect with me on any social media platform at Joe Alex Lemon, or just hit me up at my actual website, joealexlemon.work. Until next time, you guys be phenomenal.
Thank you for listening to the Real Value Exchange. If you want to continue this conversation, visit joealexlemon.work. Don't forget to subscribe for more episodes.